Hi, I'm Dr. Amy Killen, Humanaut Health co-founder and chief medical officer. This is one of a series of videos on Humanaut's regenerative medicine program. During our time, I'll provide you an overview of Humanaut Health regenerative medicine protocols I've designed for skin, scalp, and sexual health. At the end of the series, you'll have hopefully received enough information to decide if you'd like to take the next step and schedule a medical consultation. You'll need to schedule a consultation with one of our licensed providers to receive medical clearance for treatment and discuss personal questions. Our administrative and scheduling staff will not be able to address personal medical questions. Before we begin, I need to share two important messages. The content covered in this series of videos is for general informational purposes only. It's not intended to be a substitute for professional medical advice from your doctor, nor is it intended to prevent, diagnose, or cure any serious medical condition or disease. The use of stem cells and/or human cellular tissue products is not FDA approved to treat any disease or medical condition. The medical therapies performed at Humanaut Health, including regenerative medicine, do not claim to diagnose, treat, or cure any serious medical condition or disease. Let's dive into sexual health for men. One of the most common questions I get is, how do these therapies come to be? Like, who thought of injecting stem cells down under to improve erectile dysfunction? The journey of cellular therapies for men's sexual health began as an extension of research into vascular regeneration. In the early 2000s, researchers investigating regenerative medicine for cardiovascular diseases discovered the potential of stem cells to promote tissue repair and new blood vessel formation. This led to the exploration of these therapies for erectile dysfunction, or ED, given that many cases of ED are vascular in nature. This curiosity marked the beginning of a new era in sexual medicine, where cellular technologies like stem cells and their derivatives are being explored for their potential to enhance erectile function and combat age-related sexual decline. Studies have demonstrated improvement in erectile function, particularly in cases associated with vascular insufficiency, i.e., blood vessel disease. The regenerative properties of stem cells and their offshoots appear to enhance blood vessel formation, promote nerve regeneration, reduce inflammation, and stimulate the penis's natural repair mechanisms. However, the research also highlights limitations. While regenerative therapies show promise for overall erectile function, their efficacy in treating severe ED or cases with significant structural damage appears limited. These treatments may not be effective for ED caused by severe nerve damage or in people who have multiple associated medical problems, such as diabetes, hypertension, elevated lipids, or cardiovascular disease. In such cases, traditional treatments like the PDE5 inhibitors, or Viagra, or penile implants might still be necessary for optimal results. Who's a good candidate? So who's a good candidate for this type of therapy? Men experiencing mild to moderate age-related changes in erection quality or sexual pleasure are typically the best candidates for these regenerative injections, especially if they're in good overall health. Those with fewer medical issues tend to see better results compared to men with multiple health problems or a history of trauma or surgery in the treatment area. To maximize the therapy's effectiveness, it's crucial to follow post-procedure instructions carefully and maintain a healthy lifestyle. This includes regular exercise, a balanced diet, blood sugar control, stress management, and avoiding habits like smoking and excessive alcohol consumption. What can you expect from treatment? When we use regenerative therapies to try to improve sexual health, we are either injecting personal stem cells or human cellular tissue products from ethically sourced and thoroughly screened umbilical cords donated from live cesarean births. If you haven't listened to Dr. Harry Adelson's detailed explanation of regenerative medicine, cell types, and general treatment options available, please do that now. Prior to the procedure, we apply a topical numbing cream to the treatment area. We leave this on for about 10 minutes and then we clean the skin. During the procedure, injections are performed with a small needle into specific areas of the corpora cavernosa of the penis. These are the tube-like structures that run the length of the penis on both sides and fill with blood when you have an erection. The number and location of injections may vary based on individual anatomy. Despite the numbing, these injections can cause some discomfort, but most people tolerate the procedure well. In some patients, the injections are preceded or followed by a low-intensity shockwave therapy session. This handheld wand device is applied to the penis and surrounding areas to try to further stimulate a healing response. After the procedure, you may experience bruising, redness, and swelling in the treatment area. The intensity and duration of these effects can vary among individuals. Your medical provider will give you post-procedure instructions that may include the use of a penis pump, in-clinic low-intensity shockwave therapy sessions, prescription medications, and any necessary follow-up care. It can take 3 or more months to start seeing benefits. It's important to note that results can vary significantly between individuals and that some people may not experience noticeable improvements at all. It's crucial to understand that regenerative therapies for male sexual optimization are still considered experimental, and there are no FDA-approved cellular therapies for this purpose. While promising, larger clinical trials are needed to fully establish their efficacy and long-term safety profile. Thanks for watching. If you want to see if regenerative medicine is right for you, I invite you to visit humanauthealth.com to start the medical eligibility process.